So this is this part is the data insights from the CASK Rare X data collection program. Now, just a disclaimer, this data is actually from July 2025. So everything I'm showing you is a little bit out of date, because what happens is every charity, which they call PAGs, patient advocate groups, that signs up to be with Rare X, every quarter we get a load of data. So we never get access to the full database, which I think Tina will probably go into a bit more detail, but we just get kind of a lot of basic data on symptoms and things once a quarter, but it does take Rare X a bit of time. So we haven't had our next quarterly report yet. So the latest one we have is from July. So in July, we had 145 people enrolled on the CASK DCP, so data collection program, which is amazing. But we now have 151, which is even more amazing. And that just shows that it's growing all the time, which I'm very grateful to everybody taking the time to register. Obviously, it's not as large as our full community. So this is why partly why we're doing this webinar, to try and get the word out, but also to encourage people to keep using it. At the time of the quarterly report, there was 44 genetic reports for CASK patients, curatable. Now that means that they were in a usable form that Rare X could take that data and put it into their database so that researchers are able to see it. Sadly, we had 35 that were not curatable, so another 35 people had uploaded their reports, but they could not be curated. I don't know why. So that's another thing, Tina, if you could kind of talk about how people can find out if their report has been good enough or not, that would be amazing. 5 people had uploaded reports that were fine, but they weren't in a supported language. Now, Rare X is all the time expanding the number of languages it's dealing with, so that's not a problem. That's just one of the limitations to Rare X being fairly new. And also, if you don't have a genetics report, you can upload just a clinics note. So here in the UK, we very, very rarely get the actual full lab report. But Rare X allows us to have the clinic note that we got with the diagnosis, and that's normally good enough. And as you can see, so 8 people had done that. So don't worry if you can't find your full lab report. It's better to try and upload something and see if it works than not even try. And the reason for uploading your genetics reports is because it allows us, well, not myself, but researchers, to do something called a phenotype-genotype analysis. So obviously the next step is that you would then fill in surveys and, tell the database all about the patient. CASK disorders, there's a number of different disorders caused by lots and lots of different variants. And it's very, very useful for researchers to understand how the different mutations impact a person. And we can't do that unless we obviously know what the actual genetic mutation is. So that's why it's really important that as many people as possible try at least to upload their genetics report, so this kind of analysis can be done. Because wouldn't it be great, if we could say upon diagnosis a child had a particular mutation, and the parents obviously looks around, sees all these different prognoses. It would be great if we could say, oh, that child might be milder, and just give a parent a bit of hope. Now, I'm not saying that will ever be possible, but obviously if we don't investigate this and analyze it, then we'll never know if there are any connections between a variant and a severity or the set of skills they're learning, that kind of thing. So the next thing I wanted to show you is the age groups that we have. So the most common ages we have are age 5 to 9, but we do have people aged all the way up to their mid-50s, which is fantastic. And, it's really important to obviously have that full breadth of ages, because especially with like CASK disorders, which are fairly newly diagnosed, we don't really have that understanding of older patients with the disorder. So that's great that we've got that. And then we have at least 128 females enrolled and 23 males, which kind of represents what we would expect of our population, but it's great that we've got both sexes being represented. And here you can see that they're also represented from many, many continents all across the globe, which is fantastic. Okay, so on to actually what insights are we getting about our disorder? Now, we get the basic data. So all the PAGs, all the patient advocate groups get this very, very basic data that hasn't been filtered or sorted. So I think everything you see, it's just it's not like a definite, because we can't obviously sort it for males versus females. I don't believe we can even sort it for if you were a carrier as well. I believe we have some carriers on this database. So these numbers, I would say, definitely aren't definite, but it gives you an idea, doesn't it? It gives you a picture. So once you register, the first survey you get is called the head to toe survey. And this is the most important one because this opens up all the doors to all the other surveys. And as you can see, 111 people have completed this head to toe survey, which is 76% of everybody who has enrolled. So that means some people have bothered to enroll, which takes probably about an hour, and then haven't done like a 5-minute survey with a yes or no to then kind of, make sure that their patient is then actually counted. So please, if you have enrolled but haven't done anything since, this is a really simple, quick survey. And it literally just asks questions like, is there a problem with the brain, developmental issues? I mean, you can see. And just having a quick look at that data, the ones that you would expect most common developmental issues and, issues with the brain. But we can also see, like, coming down a bit lower is like growth seems to be an issue with some, sleep is an issue, and that kind of thing. But then we have more detailed surveys on all those symptoms. So this would be like a slightly more detailed survey, asking questions about the brain and nervous system. And in our community, you can see, again, unsurprisingly, that coordination issues are the most common issues, followed by cognitive impairment and then hypertonia. So I think we all know that. But hypertonia comes a fourth. But also, you've got individuals who don't have any of these things, which is fascinating and a really good insight. One thing I wanted to point out is the seizures. So the seizures are less than, and abnormal EEGs are less than 50%. Again, as I said, we don't know exactly what the cohort is for these, and that's what a researcher could tell us. But it obviously gives an indication it's definitely not 100% of our children are having seizures. So that's the kind of way you've got to take this data, which, as I said, is very basic. And then you can answer some questions on the head, face, or neck. So the most common issue here was oral dysphagia, which I believe is like dribbling, or issues chewing and that kind of thing, which I think many of us could agree with is an issue. There's also questions on the digestive system, and this slide actually shows how important this data is. Even this really basic data is for ensuring our children get like the best care. Now, a lot of our children end up in pain, and obviously because they can't communicate, we don't know why they're in pain. If you showed a slide like this to your pediatrician and said, look, out of all the digestive issues, constipation is an issue, then, they could maybe look to ruling that out. So that's why it's really important to know these things. And also feeding difficulties are obviously an issue with some of our population. And this is something that a pediatrician should really be aware of, so they can keep an eye out for it and intervene before there's any difficulties or any kind of harm done by swallowing food down the air duct and things like that. So this is why even this basic data can be really useful for our community. And then eyes and vision, unsurprisingly, many of our community have eye issues. Again, not like less than half out of this particular cohort. But abnormal eye movement and visual impairment, again, that's something that you could tell your pediatrician, you could give them this information, like we've made the infographic from last year's data, and they could make sure that you're going to see an ophthalmologist and just be kept an eye on. And then some of the other data that RETX collects is the age symptoms appear. Now, I've just chosen 4 that I thought might be of interest to people. So the seizures, this probably isn't great news, from our cohort, seizures can occur from any time from birth all the way up to 22 years. Now, when we are able to have a better look at the data, we would be able to say, but it's most likely to be between these particular ages, because that data is in RETX. It's just I don't have it. But either way, it's useful information because it shows that actually seizures can potentially happen at any age. However, when we're able to take a proper look at the data, we could then say actually, but most likely between these dates. For example, microcephaly, unsurprisingly, is either found before birth or up to 1 year old. Feeding difficulties can be found between birth and all the way up to 7 years old, which I guess is a good sign. I'm not sure what the sample size was for that, but I guess if your child's 8 or 9 and they haven't had feeding difficulties, then maybe that's, you can maybe take, hope that will continue that way. And constipation seems to be come about more commonly when they're young, which again isn't massively surprising. So why is RETX important, other than collecting the kind of data I've just shown you? And if you're on RETX, you'll know that isn't just the data. That's just very basic data that we're given. They collect a lot of much more detailed data. Well, the first thing I really want to talk about is how important the surveys are for longitudinal data. So longitudinal data is when you can see the passage of time of a patient. So you can see symptoms from when they're 1, when they're 2, over a lifetime. And I feel that is like the one thing RETX can give us that no other registry that's currently about can give us, because most of the registries are either like a standalone natural history study, which will obviously have a start and an end point, or they'll basically be time limited. So you're asking people to retrospectively remember what's happened in the past. But RETX is ongoing and hopefully will be forever. So we are going to have, whole lifetimes of data being put into RETX, and we can see any changes. So I had a quick look at some of the surveys. Now, there's a lot of surveys, I think maybe almost 50. But these are ones I really want to highlight for people to complete more than once. So once you've completed a survey, it disappears, but it will appear back in your inbox. I'm not sure if it's once a year. Tina? Yes, she's nodding her head. So it'll reappear and you'll have a bit of deja vu. But what will happen is you'll open it and it will have all your old answers in, which is a good thing, because if nothing's changed, you don't need to change anything. But if something has changed, you can just alter the bits that have changed. So I would really like people to check their inbox and see if if you have a behaviour survey in there, and to complete that. Because anecdotally, we know that behaviour can change within our population, but there is nothing published out there. And from my experience from talking to just a few parents, so this is not facts at all, but from my experience, when there's a parent of a younger child with very bad behaviour, and I've heard them talking to older parents say, oh, my child was just like yours when they were young, but they're so much easier to deal with now. However, that's anecdotal. We can find out whether that's true if people complete the behaviour surveys and if they complete them on an annual basis. Similar things with the other 2 surveys. So, excuse me, the paediatric surveys. So we do hear anecdotal stories of people losing the ability to walk. Maybe they could crawl when they were younger and then stopped crawling. But again, there's nothing. I think there's one study published about an older woman who stopped walking. But as far as I know, there's nothing else published. So it'd be great to know, you know, does this happen, and if it happens, how common is it? But we'll only know if we can fill in these surveys over time. And also quality of life. That's good to be able to assess. Is quality of life getting better? Is it getting worse? And although we probably wouldn't want to know the answer to if it's getting worse, that's really important for clinical trials and getting drugs licensed. So if you're expecting a healthcare service to pay for a drug, you need to show them that they're going to be more of a liability to that system as they're older. Well, you don't need to show it, but obviously if you can show it, then there's more incentive for them to want to pay. And I've just added the muscle survey there as well, just in case it's got anything in about mobility. And then there's a few understudied symptoms, I feel, with CASK disorders that I read about anecdotally on the Facebook groups. And so I think if we could get better completion rates of these surveys, as you can see, only about half of our community who've been given these surveys have actually completed them, then we will be able to actually get some answers about whether these are an issue for our community or whether the anecdotes we see are one-offs or maybe unrelated to CASK disorders. So I think it's coming to winter time now, and sadly we will probably see some children go in hospital with pneumonia. So the lungs and breathing survey might add a bit of a glimpse on what's happening here if people answer that. I've also seen a few times about questions about kidneys, never anything about bladder or genitals, but they're just all in one survey. So again, if people could answer the kidney survey so we can see if it is more of a common issue within the community, and also the immune survey, because our families do seem to, well, some of them, my daughter not at all to be honest, but some of them do seem to be catching more infections more easily, you know, and suffering worse, like from the flu and that kind of thing. So that would probably be, it'd be nice if we could get 100% for those surveys, just so we would get a better picture. And then the last one I'm going to talk about is the one everybody hates doing, because I can see, one, because I used to hate doing it, and two, because only 27% of the community who it's been given to have completed it. And I know exactly why, because this is the medical encounter survey. And what it does is it asks you to list all your medical appointments for the past year, which nobody wants to relive that and nobody wants to type it all in. However, it is really important. I talked to somebody a few years ago who is on like the more licensing side of the treatments of the drugs, and they need to know how they need to know this information, because again, like I was saying, if a child has 100 medical appointments or 10 medical appointments or 30 medical appointments, whatever it is, every medical appointment costs money. And for a treatment to be licensed and then paid for by a healthcare service, they sadly need to put a cost on the burden of a patient and then work out whether it is worth paying for a treatment, because some of these treatments are millions of pounds. Without data on how many medical appointments they have, that's very, very hard to do. So I'll just give you the trick I do, which makes it really simple now to do. I use my calendar on my phone, and every time my daughter has an appointment, obviously I put in what the appointment is, but then I always put in her name and then APPT, short for appointment. I mean, you could put in anything you wanted, but I always put that in. And then when I get this survey, I just do a search in my calendar for APPT with her name, and up comes all her appointments. And then they're all there, and it takes me probably 4 minutes to quickly type everything in. So that is like super important, even though it seems like it's not actually that interesting or important. It is. It's just I didn't understand. We're not going to understand the whole process, are we, of how to get a treatment to our children? But that's what RareX understands, and that's why they've put these surveys out there for us, because they have decided they are all important. So if you can do as many as possible, that would be great. So that is me. I just wanted to say thank you to every single parent and carer who has spent time completing the surveys, because I am one of them and I know it takes time and effort and we don't always want to relive what's been going on with our child. And thank you to RareX and Global Genes for providing this incredible free resource. We don't need to pay a penny. It's absolutely amazing. And also thank you to all the PAGs who help with the recruitment for RareX. So that's my foundation, which is CASK Research Foundation, Cure CASK Australia and USA, Project CASK, and Association Enfants CASK France. Plus, we have some new members of the CASK Coalition, and they also support it, and that is CASK Luxembourg and Pro CASK Italia. So, yeah, I'll just stop sharing and then open the chat. So do we have any questions? That seems to be. Oh, here we go. Yeah, let's have a look. So Thierry says, yes, it would be interesting to know if people could know whether their genetic reports are curatable or not, and then why, so they could ask their geneticist. So Tina, over to you.
Yes, so I did answer this in the chat, but in case anyone can't access the chat, so you can, once you upload your genetic test report, I am on the genetic curation team, so I will be the one looking at your reports. So if they are not curatable, there's a list of reasons of why. So if you go onto your RareX dashboard and you go onto there's two tabs, there's new and completed. If you click completed, you should find your genetic test report there. And once you click on it, it'll tell you why we couldn't curate it. So oftentimes the reports that are not that we are not able to curate is due to the fact that caregivers will upload the genetic test report or clinic note to their caregiver account instead of the patient's or the child. And so when that happens, the names, they don't match. So we want to make sure that when researchers or whoever access the data can line up that specific genetic test report to that patient with that date of birth, like age-wise. So that's one of the reasons. The other reason is it's poor quality. So it's blurry or it's cut off. We want to make sure that the name is on the genetic test report to match with the name on the account. So date of birth doesn't really matter on the genetic test report, but we want to make sure, like, if you have received a clinic note saying, you know, it's very nice to see you, Mrs. Jane, you know, your daughter, you know, Melissa was seen here, and this is her genetic test results. That's what we want to see, even though it's addressed to you, but it's talking about your child. So those are the main reasons, which you can find in your completed tab. And if you have any questions, if you can't find it for whatever reason, you can reach out to RareX support, and we're more than happy to tell you or direct you to find the answer.
Thanks, Tina. That was great. I didn't know that either. So that's really great. I've just looked through the rest of the chats. There's only really one last one from Grace saying she's on the website. She can't find where to complete the surveys. But I feel like, Tina, you're probably going to be able to answer Grace's question with your presentation.
Yes. So I know Terry just uploaded a screenshot. We'll do a live demonstration here. So Terry, if you can click on those three dots on that side, and you should be able to view it. There should be an option, and let me know if it doesn't work.
I need to find him and see if I can unmute him. Yeah.
Great.
Thierry, you're unmuted. If you want to speak, you're allowed to.
So yeah, Terry, if you scroll down, you should be able to see everything on there.
His mic doesn't work. Oh, should Chiara could get back to us. He's one of the Oh, here we go. Here we go.
Yeah. So I'm assuming the poster that was uploaded was not curatable, which I can look here. Terry, I can reach out to you after this webinar, and then we can work on one-on-one, and I can walk you through any questions you may have. Great.
Yeah, thanks, Tina. And yeah, every time I've reached out to RareX with any issues, they've always got back to me really quickly. So please just message. It's the support. I think at the end of your presentation, you have the email address anyway, don't you, Tina? But
Yes,
yeah, they're really helpful because it's not. It's easy to use once you've used it a lot, but like anything, you've got to get used to it. And doing something new can be tricky. And yeah, somebody mentioned about, I think you mentioned before about there's the caregivers. You have to pick between like being the caregiver or the patient and that kind of thing. So I think that can be another issue. But yeah, Tina, I can always set you up with chatting to Thierry after. I'll send you each of the details anyway. Right, so I think that was it. So over to you, Tina. Do you want to see if you can share your presentation?
Let's give this a try. Let's see here. Okay. Can everyone see my screen? It should say CASK and RareX data collection meeting.
Yep.
Okay. Let me start the slideshow. Okay. Awesome. Okay, let me make sure. Okay. So where is RareX? I know that Laura went into detail about everything that we've done and all of the surveys that we have implemented on our platform. So just kind of like taking it back a little bit. RareX is a program of Global Genes. It's a research arm, as you can say, of Global Genes, created to accelerate rare disease research and treatments by removing barriers for data collection and sharing. Our platform is used to collect and connect and share data to biofarmers or researchers, whoever wants access to the data. And just to give a little bit of intro, my name is Tina Ding, and I'm the research associate here at Global Genes. I do a lot of things on the RareX platform, so I know the ins and the outs, from playing a part in implementing our measures, or even playing a role in the genetic curation team, as I mentioned before. Okay. So this kind of walks through your journey in the data collection platform. So in the patient community, we have a page for CASK, and I don't know if I can share that link here. Let me see if I can navigate back to the chat. Okay. So that is the CASK community page that gets started. So I'll show a little bit later, but essentially you go on this page, you enroll in the platform, and I'll walk you through like the terms of use, as well as the consent pages, data sharing preferences survey, and then head to toe, as Laura mentioned before, and I'll go more into depth later on in this presentation. So yes, this is the community page that I just put in the chat. This is where you'll get started or log in if you already have an account. And then I'm just going to skip forward a little bit. Okay, so once you hit the Get Started button, you're simply requesting access. So you'll put your name, your email, your age, and what kind of participant you are, whether it's patient or caregiver. I assume most of the time will be caregiver in this community. And then you'll hit that sign up button right at the bottom here. Once you sign up, you will get an email telling you to set up your password. So when that happens, that's when you have officially set up your account and you can log in. So this is just showing, like, once they'll give you a link where you can sign in and do all of this stuff. But here's where you can access the privacy policy as well as terms of use. So I just wanted to highlight, since you all are in the UK, we are GDPR compliance. So a lot of our patients or caregivers, they're located globally. So we want to make sure that your data is protected at all costs, especially when you're uploading like clinic notes and very patient identifying information like date of birth, or even your address even. So we want to make sure that it is all compliant. So this is that terms of use that I was talking about. This is where you go through the patient informed consent. So as you can see here on the left, this is just like a little tracker to make sure that you complete everything. This is what we call a mandatory workflow. So once you start up your account, you'll go through all of these documents as you would when you participate in a research study. So this is very important because we are not able to collect your data until you have signed this informed consent. So it can go through, like, here's this 8 pages detailing just everything, is who is funding RareX, do you have to take part of this, what will it require, and all of the data policy as well. This is one of them. You're gonna tell us why you're taking part, whether you're a family member or a parent or a caregiver, and then it'll ask you about being contacted for follow-up research studies, or if PAC, patient advocacy groups, can reach out to you. But since you're here, you're all in the patient advocacy groups. This just goes on to giving us your consent by writing your name. And then this goes through the general information. This is the caregiver demographics. You'll put in your name, your address, and date of birth, all of that, as well as these other information about birthplace. And then moving on from caregivers, this is where you get to add your patient. And this is one of the most important part, because if you just log on as a caregiver and you don't add a patient, then we really don't have any information about a patient who's been diagnosed with CASK-related disorders. So it's really important that you add your child or whoever you're caregiving for. And then it goes through the same process, because we need to have consent for the patient itself and their demographics. And this is the way to kind of link the data about the patient to the community, is by selecting in this rare disease box of CASK-related disorders. So the only way that Laura was able to present all of that information to you before in the beginning is because the caregivers or patients selected CASK-related disorders. So that's really important for us to see all those high-level data in that specific community. Okay. One of the things that makes kind of RareX stand out from other registry is our data sharing preference agreement. So I do want to highlight that your data belongs to you. It does not belong to any institution or academic institution. It belongs to you, and you get to select how you would like to share your data, whether it's general research, whoever, researchers can come on and they can ask data related to the CAS-related disorders. So your data will be included in that. Or if you want to just focus on health and medical biomedical research, you can also select that as well. So you get to choose how you would like to share your data. Because to emphasize again, it belongs to you. So then even further taking a step, you can select how specifically limits on your data. Do you want to share it with just solely non-commercial purposes? And this kind of outlines what that means. Or only research that has been approved by the Institutional Review Board, which is the IRB. So like I said, again, the data belongs to you. You have every say in how you want to share that data and who you want to share it with. Okay. This just goes on to sharing your contact information with the patient advocacy groups. And obviously you guys are all here, so you guys do belong to a group. Okay. Before I move on to genetic report upload, does anyone have any questions so far? Okay. So as part of this mandatory workflow, once you're done completing the data sharing agreement, it'll ask you if you would like to upload a genetic test report. Now this, if you have it on hand, you can upload it. If not, you can just move on and upload it later. It's not super duper important. But one of the things that I do want to highlight, which I've also put in the chat a little bit before, and Laura kind of mentioned this, in the UK or internationally, it's very rare that you get the official genetic tests report from the lab itself. So that's the reason why we also take a physician note or a clinic note, as long as it has the gene that they've been diagnosed with, the variant, and this is consistent with CAS-related disorders, that we do take. And that goes on to being shared with researchers or biopharma or whoever you want access to your data. So we'll take it all or whatever you have access to, because we know sometimes it can be hard. So please upload whatever you do have relating to genetic test results. I look through them all. I have firsthand with every single document. So I will clearly outline if it's curatable or not, like I've mentioned before. Okay, so kind of once you finish your the data sharing agreements, genetic test report, you'll go on to do what a head-to-toe survey. This is kind of what Laura was talking about earlier when she was sharing you some high-level data. But the head-to-toe survey is important, like Laura mentioned. This kind of goes through very, very high level. So this goes through every single body system that we have. So from head, face, and neck, to your eyes, to your lower mobility, upper mobility. And why this is important is because it kind of branches to level 2 surveys. And so for example, if you answer yes to having issues with behavior, you will get a level 2 behavior survey, and that goes more in detail. For example, like asking about depression, anxiety, or aggressive behavior, or any other questions that are related to that high level question. So it's super important to complete head to toe, because then that branches to other surveys on the platform. Before I move on to this caregiver dashboard, I do want to say that we have about 77 surveys on our platform, and that is including patient-reported outcomes. So patient-reported outcomes are just validated questionnaires. So these questionnaires have been developed and kind of collected data across a lot of groups to make sure that it is asking what it needs to be asked. So these are highly researched questionnaires that are implemented in a lot of clinical trial studies, research studies, just across the board. And so we made sure that we have a little over 50 patient-reported outcomes, and you will not get all 50 or even 70 surveys. It's just based on how you answer the head-to-toe survey and the level 2 survey. So I know answering surveys multiple times, like there's a lot on your dashboard and you don't know what to prioritize. So just know that you're getting surveys from a pool based on your answers. And this is why RareX is very different from other registry, because we don't ask everybody the same surveys. We base it off of what symptoms you have reported in the patient or the child itself, in order to branch to that survey, if that makes sense. So for the caregiver dashboard, this is what I was talking about. You want to make sure that you are viewing your patient or child's account. So oftentimes, this is why the genetic test reports are not curatable, because you are not, your child's account will be listed here. If this does not show up, that means that you're uploading that document, specifically genetic test report, in your caregiver account, which makes it not curatable. But if you just switch that role, and once you view your child's account here, you can upload that genetic test report. Okay, I'm just going to check the chat really quickly to make sure we don't have any questions. Okay. Okay, these are the level 2 surveys that I talked about. So these will only populate if you answered yes or unsure to the head-to-toe survey. And this is how it kind of branch out, and it will be labeled. Keep going. This is just a snapshot of our eye and vision survey, level 2 survey. So you'll be asked, is this a symptom apparent? Yes or no, and it'll break down to every little bitty thing. And then you get to put the age of when the symptoms first appeared and the age at diagnosis. So this is reflected, all these 3 questions here are reflected to every single level 2 survey that has branch in your account. Okay, we also added a kind of like an open text field, but we know that our level 2 surveys does not cover everything. We do our best, but we have an open text field at the bottom where if we did not list the symptoms that the patient is experiencing, you can list it here at the very bottom of each level 2 surveys. You can click yes to additional issues, and then you can describe exactly what we missed. Try really hard not to include any identifying information in these free text box. So nothing like, you know, my child Melissa was like, had this aortic root dilation. So just avoid that. Just simply list the symptoms, because what happens is that when we share your data to researchers, we de-identify everything. So your name, your date of birth, everything about that can identify you is completely removed. So in these open text field, if you put any patient identifying information on there, we have to clean it up, which kind of makes it harder. So please just remember that. And once you go into your level 2 surveys, we also put a brief disclaimer to not include any identifying information. Okay. Besides the head to toe and the L2 surveys that Laura and I have highlighted to be important, the other thing is this diagnosis survey. So this is a survey that we have created for our communities. I don't know if there's another slide. Okay, yes. So this diagnosis survey will let you indicate what specific conditions you have within CASK-related disorders. Let me see if there's another. Yes, okay. And it'll ask you, was genetic testing done as part of your diagnosis? It'll ask about your family history and newborn screening. So it just goes more in detail. And to my knowledge, not a lot of registry will ask about newborn screening as one of them. And this kind of gives us a quick but very thorough snapshot of everything related to CASK-related disorders within your family. Okay. And this kind of goes through the how to upload a genetic test report. So kind of like what we've been outlining in the chat. Once you're in your role as a caregiver, you're viewing your patient or your child's page, you'll go to the documents. You'll click this upload button. Once you click that upload button, this number 2 here, a window will pop up. And this is where you can upload your PDF, your JPEG, your PNG file, whatever file you have. You'll upload it here. You'll tag it as a genetic test report. Tagging this is really important because it allows us to actually see it as a genetic test report. I think this is a required field now, so you won't be able to close out of this unless you tag it. So once you tag it as genetic test report, you'll click save, and then you'll be able to view it as such. So you should see in your, if you already, those who already have a RareX account, you should be able to see like how you uploaded it, the date that it was at, and how it was tagged. So that's how you upload a genetic test report or a physician's note or clinic note. Okay. So this is what Terry was doing earlier, but on your dashboard, you get to go to completed, and you can look at your previously answers by clicking these 3 dots right here and clicking view. If you, for whatever reason, need to retake a survey, you can also go through the same method of these 3 dots and click retake. When you retake a survey, both the old version and the new version save, because we want to collect that longitudinal data, like Laura has mentioned earlier. And just to kind of reiterate, each survey that you take, we do have a kind of a renew period where after that 1 year, it will pop back into your new and in progress tab for you to retake it. And it's super important collecting longitudinal data because that's what researchers want. That's what biopharma want. They want to see your disease progression over time, or how did the symptoms change, or if it didn't change. It's important to see that data over time from, you know, when you were first diagnosed or when it was first when the symptoms first appeared to how we are doing now. Let me see if there's another. Okay. The other thing let me see if I can go back. Okay. The other thing that I want to highlight is Laura did mention a medical encounters survey. I think you guys were at 27%, I believe. So that survey is very long, like you mentioned, Laura, and it could be very time consuming and sometimes difficult. So for now, we have actually deactivated that survey. We wanted to make it more functional and more purposeful. So we have deactivated that survey. Those who are in the RareX account today or going to sign up, you will not see it. We are trying to figure out other ways to make it a little bit better and not be so burdensome. So we will keep all PAGs updated once we have reactivated that survey. The other thing I just want to highlight over here, let me see if I can go back before I end this discussion. So here, for those who are new, you'll see on your new and in progress dashboard, each survey has a time to complete in minutes. So, you know, quality of life survey will take 15 to 20 minutes, or like the HUDAS will take you 15 to 18 minutes. So it kind of breaks down how much time we think it will take for you to complete this survey. This is very on the conserve side of estimation. So it might take you quicker depending on your answers. But you know, if you're during, I know the holidays are coming up, but you know, if you have some downtime to complete these surveys, you can pick and choose. It'll be great ideally for everybody to answer everything on their dashboard, but realistically, that might not happen. So you can pick and choose, you know, if you're like, oh, this survey is only going to take me 5 minutes, you can spare that 5 minutes. Or you'll see how many questions there are. And oftentimes these questions, they're branching logic as well. So it might take you much shorter than usual. So again, you can pick and choose. We do recommend that you take the diagnosis survey right after the L2 surveys. It's important to get that high level information, especially if you don't have a genetic test report, or if you don't have any clinic note that says that specific genetic test results. So this diagnosis survey allows you to self-report, like, I heard my physician says this and that and that and that. So that's what the diagnosis survey is there for. Okay. If you have any questions or technical issues, this is our email. This is rareXsupport@globalgenes.org. Please feel free to reach out with any questions you might have. I am monitoring this this inbox, as well as our Caitlin Hobbs, our Senior Manager of Community Engagement. So we'll be the one who are answering your questions. Yeah, let me make sure. Is that the last slide? Yes. Okay. Does anybody have any questions?
I put a few in the chat box.
Oh, great. Okay. What other documents should we be uploading other than genetic reports? Yes. So clinic notes are a good one. Especially if it contains information about the gene or the variant that you have been diagnosed with, or your kid has been diagnosed with. Those will be accepted. It doesn't have to come from a lab at all. Second question is, are caregivers allowed to download their own completed surveys and share them with other registries or researchers? Yes. So let me kind of demonstrate that a little bit in the, okay, yes, here. So once you click view, once you click these 3 dots in the completed tab, you can have the results emailed to you. So you can take this wherever you like. Like I said, the data belongs to you. So feel free to download them or have them emailed to you, whatever option is available. And then the third question is, are you collaborating or hoping to collaborate with Citizen Health? I actually cannot answer that. I'm actually stepping in for Caitlin Hobbs. Yeah, so I don't know the answer to that, but if we are collaborating with Citizen Health in the future, or any movement in that area, we will be sure to keep PAGs updated or have a press release. Let's see.
I think the next one I can answer. It's from Sarah. Our child has been diagnosed for 2 years. asking about support groups. What are some of the sites or spaces people participate in to stay connected? So we have a very active, well, not we, it is not associated with my foundation, but there is a very active Facebook page, global Facebook page, which has many questions and answers on it, and lots of friendly people. And depending on what country you're in, if you're in the UK, there's a UK Facebook group as well. There's a WhatsApp group. But your first bet, because I'm not sure what country you're in, Sarah, is the global Facebook group. But do be sure to check which charities there are. Oh, in the States, okay. So there's a few CASK charities in the United States with communities. I think there's 3 actually. But the Facebook group is brilliant, and there's a lot of Americans on that Facebook group. So I think that's probably people find really helpful. Obviously, if you're not on Facebook, then maybe approach the different charities, I would say. And then I asked the next question, Tina. Can you remind me what languages X is up to with translating surveys? Have you got the list?
I don't have a list. We are for translations wise, it's actually put on hold because of I'm sure you guys are all familiar with the United States economy, but funding has been cut, and so a lot of our resources and our plans to translate has been delayed, unfortunately. But I do want to kind of share my screen on another tab. Let me see if I can do this. Share this tab instead. Okay. Can everybody see this Tina Dang dashboard here? Okay.
Yeah.
So this is not translated by RareX by any means. This is our kind of like third party that we use to host our platform. But this is what we've been using as an alternative until we figure out the translation details. So here for families, they can click this world icon here, and you can switch between Espanol and then French and Portuguese, and it will give you kind of the higher level translation. But as far as like surveys go, like patient reported outcomes, like those validated measures that I briefly spoke about, those will not be translated.
Okay, thank you for that update. Yeah, that's such a shame. But I remember you say, well, maybe Caitlin saying how expensive it is to do all the translations, and that was before funding issues.
Yeah.
So yeah. Okay, but that's good. But they can kind of do, some data is better than nothing, isn't it? So and they can access it in Spanish, Portuguese, French.
Mm-hmm.
So fantastic. Okay, thank you. I don't think there's any other questions. If anybody has a last question, put it in the chat. No? Well, I just want to say thank you, Tina, so much for coming along, and also for all the work you do with Global Genes. And as I said, thank you. Very, very grateful to Global Genes.